Hi, my name is Dr. Vijay Madhuri, fertility consultant, Ferty9 Fertility Centers, Banjara Hills. Today I am discussing you about a topic called endometriosis, which we mainly see in 10% female reproductive population. First, I will just tell you about what is normal endometrium and what is endometriosis also later on. First thing is, this is our uterus, okay? These are the fallopian tubes, these are the ovaries. Normally, for a woman to get pregnant, every month one follicle will be growing. In that follicle, one oocyte or egg will be there. That egg will be released and it will be coming into the fallopian tube. At the same time, if the couple are having intercourse, the sperm will be deposited here. The sperm will be traveling in this way and come to the tube where the egg is there, and both of them meet and then it forms an embryo. Fertilization will be done in the fallopian tubes. Later on, it comes in on the day 5, it comes into the uterus and gets implanted in the uterus, and we call it as a pregnancy. But in case if the sperm and the egg are not meeting, for in case if in that month if the patient is not becoming pregnant, then we will get period in that month. Okay, so this period bleeding will be the first layer. We call it as endometrium. Okay, the first layer of the uterus is called the endometrium, and the next layer is a muscular layer, which we call it as a myometrium, and the next layer we call it as a perimetrium, which is a serosal layer. For women, throughout their lifetime, during their periods, this endometrium layer will be shedding out. Okay, this endometrium layer, instead of coming outside, sometimes for few patients, this endometrium, 10% of patients, female reproductive patients, how I told, this endometrium layer will be going into the fallopian tubes, from the fallopian tubes into the ovaries, and from there it gets deposited on the urinary bladder, on the rectum, and on the intestines for few patients. Okay, this we call it as endometriosis. In case if this endometrium layer or this bleeding goes into the muscular layer of the uterus, we call that as adenomyosis. Okay, every month when we are getting the periods, how this endometrium layer is shedding out, if these deposits are implanted on the fallopian tubes, ovaries, and on the urinary bladder, rectum, those also try to bleed sometimes. Okay, because of that bleeding, in the fallopian tube there might be some adhesions. In the ovaries, because like every month how it is bleeding, this endometrial tissue also starts bleeding and it forms as endometriomas, means chocolate cyst we call it as. It is filled with dark color fluid, so it forms as a chocolate cyst. And on the urinary bladder also, because of these deposits, we'll have severe pain when we are going for urine. We call it as dysuria. And on the rectum also, we call it as dyschexia. Okay, so patients whoever is having pain during the periods, very crampy pain before the periods, during the periods, and after the periods, there are chances they are having endometriosis. And when they are passing their urine, or when they are passing their stools also, we call it as most of the times endometriosis. But we should diagnose it properly, and accordingly we will tell whether it's endometriosis or not. So we call it as a triple D disease. So D for dysmenorrhea if we are having very crampy pain, D for dysuria if when we are passing any urine, if we are having pain, dyschexia, other D is dyschexia is if any while we are passing our motion, if we are having pain, we call it as dyschexia. So triple D disease we call this as. Okay, whoever is having this disease, there are chances of 40% patients leading to infertile. Okay, why? Because endometriosis, because of this endometriosis, I told no, there will be chances of less implantation, because endometrial receptivity will be reduced, and because of this endometriosis in the fallopian tubes there may form some adhesions. Because of endometriosis in the ovaries also, this I told no, endometriomas or chocolate cysts, because of that the quality and the quantity of egg also will be reduced. At the same time, because of this implantation all over the abdomen, these ovaries and the fallopian tubes, everything goes and attaches to the like uterus or to the walls of the body, abdomen, so that total of the pelvic anatomy get disturbed and there are chances of infertility. So patients whoever is having severe pain during their intercourse or during their periods, motion, or during their urine, it's better you consult the nearby doctor to find out what the disease is. In case if it's really an endometriosis, then it's better you should plan pregnancy very fastly, because endometriosis we can't stop here. It is a progressive disease. In case we are taking tablets and injections, for some time it may reduce, but once we stop, it will be going on. So it's a progressive disease. We can't stop there then and there itself. So it's better you plan for pregnancy very fastly. In case if you are having more doubts about this endometriosis, you can come directly to our Ferty9 Fertility Centers. We will clear all your doubts. Thank you.